I'm a pediatric immunologist and professor of pediatrics at the University of Brescia. There are very limited options. The patients who develop HPV-related disorders, and that happens about 10, 15 years of age, in the majority of patients with WHIM syndrome, they can try to treat with a surgical option, with cryotherapy, or with immunological modulators such as imiquimod, but there is a very bad response to all the treatment. And when they develop tumors, I mean carcinoma, genital carcinoma, the only option is surgery. So that's the worst scenario that might happen for this disease that was apparently benign disease, but sometimes can have a very bad prognosis. And even now, when we know more about the pathophysiology, we know that we need a specific treatment to treat these disorders in the framework of WHIM syndrome.